Today, we're diving into a mission that's looking to bridge the global health gap, and not just with good intentions, but with some really smart, sustainable technology. We're going to look at how digital infrastructure can become the backbone for primary care pretty much everywhere, and how that could literally change millions of lives. 60 million. Just let that sink in for a second. According to the World Health Organization, that's how many lives we could save by 2030 if we just scaled up primary care in low and middle income countries. It's a massive number, right? It represents so much human potential. But it also forces us to ask a really important question. Yeah, how do we actually do that? How do we turn that incredible potential into something real? It's not just about building more clinics. It's about connecting them, empowering them, and just making them way more effective. And that's a big challenge we're digging into. Okay, so first, let's really get a handle on the scale of this problem. We're talking about a global health gap that affects billions of people. Think about that for a second. Half the world. For so many people, healthcare just isn't a given. Millions of people live hours, sometimes even days, away from the nearest doctor. And even if they can get to a local clinic, those places are so often under-resourced and just completely cut off from the rest of the healthcare world. And then there's the financial side of this, which is just devastating. Over 1 billion people every single year face what are called catastrophic medical costs. This means one sickness, one accident can throw an entire family into poverty. It's this vicious cycle where being poor makes you sick and being sick makes you poorer. And the problem gets even deeper when you look right at the front lines of care. It's not just about not being able to get to a clinic, it's a huge information gap. Technologically speaking, a lot of these clinics are basically flying blind. Just look at the difference here. On the left, you've got paper-based care. Everything's disconnected, it's super prone to error, and it's just plain inefficient. Trying to track a patient's history or manage a long-term condition, almost impossible. But then look at the other side. With digitally enabled care, suddenly you have a connected history. You can make decisions based on data, and you can actually manage health proactively. This, right here, is the digital divide in healthcare. And listen, this isn't some abstract idea. This is the on-the-ground reality. In sub-Saharan Africa, for instance, almost 15% of health clinics have no electricity at all, and only about 40% have power they can actually count on. When that's your starting point, of course you're using handwritten logs. A digital future can feel like a complete fantasy. So you're faced with these huge, seemingly impossible challenges. Where do you even begin? Well, this is where Novus Health comes in. They're trying a totally different approach, and it doesn't start with the tech. It starts with a core belief. This quote, it just captures their mission perfectly. It's all about equity. It's this powerful belief that a tiny clinic in a rural village deserves the exact same quality of digital tools as a massive hospital in a big city. It's about leveling the playing field for everyone. So how do they actually make a vision like that work? This is the key. Novus Health operates on what's called a revenue-neutral model. The goal here isn't to make a bunch of profit. The goal is to be super efficient, cover all the costs, and then pour every single dollar that's left over right back into the mission, expanding access and making the platform even better. All right, so with that mission as the foundation, now we can look at the how. How do you actually bring modern cloud-based healthcare to places that have totally unreliable infrastructure? Their solution is actually pretty brilliant in its simplicity. It's a two-part approach. First, they have an affordable, lightweight electronic medical record platform, an EMR, that's built specifically for primary care. And second, and this is the real game changer, they create what they call digital health hubs, which solve that whole infrastructure problem right on the ground. So what is a digital health hub? Well, it's basically the missing piece of the puzzle. It brings in reliable electricity using solar power and batteries, it provides dependable internet access, and it offers on-site support. This doesn't just turn on their EMR system, it creates this resilient, connected ecosystem that completely changes what a local clinic is capable of. Now, something this big can't be done by one group alone. The final piece of this whole thing is collaboration, getting the global community together to really scale this impact. So I just want you to imagine this for a minute. What if every single clinic, no matter how small or how remote, was connected? What would that mean for preventing disease, for managing chronic illnesses, for responding to the next pandemic? I mean, it would fundamentally change global health as we know it. And this, right here, This says it all. This is the main takeaway. It frames this whole thing not as some business venture, but as a shared mission. Any support isn't an investment in profit. It's an investment in a sustainable, equitable future for healthcare for everyone. So if this mission is something that speaks to you, whether you're with a global health organization, you're an impact investor, or part of a public agency, the invitation is out there. Partner with Novus Health to help build a world where no patient and no clinic gets left behind. You can learn a lot more by visiting their website.